Hello, everyone. This is Dr. Sri Banerjee, Dr. B, and this week, what I will be going over a little bit more is shedding some light on understanding funding sources and how each level of government play a role in trying to um, conduct surveillance activities. Now, just as a reminder, surveillance activities are a lot more than just data analysis. It's the act of collecting um, data, analyzing, and also interpreting data. So um, it's so much so that there are extremely important aspects that you have to take into consideration when surveillance is being conducted. So you have to be at all times thinking about not only the critical aspects of data collection, but also how to best store some of this and the support activity that's needed. So this framework really shows um, how all of this is organized in a surveillance system. So you have training need, you have needs, you have supervision needs, communications, resource provision, and then of course with surveillance, feedback, analysis, confirmation, both epidemiology and laboratory detection. How do you detect certain variations and patterns and what you do in specific instances. So again, this week the focus is funding. So depending on your disease condition or what you choose to um, go over, it really varies based on the disease condition. So one case I can think of is adult lead surveillance. So lead is an area uh, which adults get exposure to through occupational sources, whereas children they get it through drinking water and old pipes within the school system. So when you're thinking about adult lead, a lot of those surveillance efforts is conducted from the federal government. Is excuse me is funded by the federal government by the Centers for Disease Control. Uh, NIOSH is the organization for occupational health. And as it turns out, they funded the surveillance activities for quite a few states, but the state that I currently reside in, there was funding activity was halted as of 2013. Subsequently, in 2015, 2016, many of the prevention programs that are out there, screening for the purposes of prevention, also got slashed. So not only was there a problem in terms of uh, lead exposure not being adequately handled, but also we had no way of knowing the gravity of the problem, and there was a lot of underreporting going on. And this is a continuous problem with existing surveillance systems. So thinking about how funding plays a role in all of that and how um, in practical considerations funding is not readily available, especially when there's pandemics going on and other public health priorities, which have a tendency to take precedence. So at the end of the day, what you're trying to build is a surveillance system under um, allocated funds, which are not necessarily plentiful always. So even though we're not talking about a resource poor settings, a lot of times the availability is just not there. So these are the types of information cycling that takes place within a surveillance system. And finally, thinking about what type of response will guide the type of surveillance system that is needed. And so there's an acute type of aspect that is needed to be uh, visited, but also planning what the periodicity will be for future needs. then, so in terms of support activity, of course, communication, data collection, transmission, feedback, dissemination of information, but also supervision and training. Um, think about all the personnel that you'll be needing there. What is the funding there? So these are all the funding considerations that are needed. Um, and depending on the various types of information that is required, um, it could be for control activities, for disease monitoring, administrative data, health system monitoring, health indicators, so that's health status, um, or just early warning information. So these are the four areas, quadrants, which are required to take into consideration. Again, to understand the natural course of disease, these are all aspects which are extremely important. So just keep this in mind when you're thinking about surveillance and what are the different aspects which are important to keep in mind when you're thinking about all of these surveillance systems. So this is a good stopping point. I'll be lecturing further next week as we encounter some other challenges of surveillance systems. I hope this lecture has been helpful. Please do not hesitate to reach out to me if you have any additional questions. Thank you.